chapter 1. Intro to nursing. Now, sometimes I will be nice and tell you what not to worry about. Sometimes. Sometimes. Okay, every now and then. That means don't even waste your time on this. Okay? Other times, if I remember, I remember. But if I feel like it's important to share, I'll share it. Okay? Or I'll go over it, in other words. Alright? Anton, since that's the name I remember. I pronounced it correctly? Yeah. Anton? What is nursing to you?
Nursing to me is having the education to provide somebody with the best health services and compassion that are possible to do.
Okay, I like it. What's another name I remember? Alejandro? Finish your drink. He's like, oh. What is nursing to you?
Nursing to me, I feel like it would be kind of the same what Anton's kind of said. It would be like providing the best possible kind of healthcare you can give to a person, being compassionate, being helpful, like an assistant to the doctor almost.
Ooh, assistant to the doctor. Go ahead. There's a reason I say that. Okay, and we're gonna stress that. Go ahead. What else? Anything else?
A good communicator.
Oh, and to Alejandro, continue, porque you're speaking a love language to me. Okay, you're speaking I feel like you're enticing me. Go ahead, continue on.
Like being efficient.
Okay, those. First of all, leave my Spanglish alone, okay? Go ahead. What else? You said assistant to the physician. You said an excellent communicator. What else?
He's like being safe, obviously. Try not to.
I feel like this is I'm very enticed. I'm falling in love, Alejandro. You're speaking my language. Anything else?
I think that's all I got.
Trinity, what about you? What's nursing to you? Oh, educator. Yes. Ooh, from birth to... Okay, what about death? Hello, we do deal with death, okay? Where my hospice nurses at? A couple of you are in here. Where y'all at? Okay? We do deal with it. So from birth to death. And sometimes death comes first. Okay, what else you got? That's all I got. You caught me out. Brianna, what about you? Ooh, another Brianna. Hey, okay, Brianna.
Nursing.
Oh, let me write these down. Hold on. Did y'all read the book? Y'all read before y'all came to class?
It's called read.
Kenoshia's like, no, I didn't do what I was supposed to do. All right, advocate. Let me write these down. Advocate, communicator, quality care. Safety. What else he said? Assistant to doctor, MD assistant. Let me put MD assistant. And I'm gonna clarify this a little more. Okay, and that's okay. Y'all on the right path. Okay. When it comes to, let's talk about the history of nursing. First of all, I ain't gonna test y'all on this, okay? But it's good to know where your profession came about. Number one, back in the day, in early Christian period, it was thought that nursing was basically, not thought, but nursing was that profession where you just go in and visit people at home, visit the sick, those who are sick, okay? Especially during the early Christian period. You will see that nursing has continued to expand and grow more than just going out and visiting the sick, okay? It did shift from a religious orientation, whereas the emphasis was like on taking care of, there are some cultures where you will come and they'll actually have like a temple, so to speak, and take care of these people as well. but it grew from that. Like it says, there was an emphasis on warfare, exploration, and expansion of knowledge. This is one of the reasons why nursing is one of the most reputable professions, because we continue to evolve and grow, especially when it comes to knowledge. One of the things that we do as nurses, as quality care providers, is provide care based on evidence. Hence, what's my doctorate, my soon-to-be doctorate? Where you at? Go raise your hand with pride, girl. Okay, this is where we're going to need you to make sure the nursing profession continues to thrive, okay?
Amen.
All right? Hands to knowledge. Yes, amen. Okay, preacher. Okay, let me stop. Now, let me tell y'all, back in the day, nursing was a profession that did have a very poor reputation. Like, we was like, yeah, if you was a nurse, okay, again, it was done by women, of course, back in the day. It was that profession that it was done by prostitutes. Okay, simply put. Take care of the people that can't, the war veterans, or who were sick, who got ill or hurt, take care of them. The nurses would take care of them, and then that was that. And also, it was such a profession that was not well respected, that it was, like they said, nurses received low pay, worked long hours. I still feel like that's the case today. All right, and in unfavorable conditions. Like it was worse. Like it was bad. Okay, but then it continued to grow. Okay, like it says here, historically you'll see social reforms change the way nurses, the nursing role evolved, especially when it came to women handling the nurse. It used to be that the nurses was done by women only. It was a woman's profession, but now we see that evolve. And men, thank you, because of y'all entering the nursing workforce, now we're more respected and we get at least more pay. All right? All right. Now, I will really test you on this maybe one time or two, okay, throughout the term. You cannot leave the nursing program and not know who actually helped establish nursing and make it a more reputable profession, which is Florence Nightingale. Now, of course, there is talk and arguments that there were other individuals who contributed to the nursing profession, like Harriet Tubman, Mahoney, etc. But you got to know that Florence Nightingale, that's why you get the Nightingale Award during penning. She helped establish it, make it more reputable by creating the first nursing school, wrote books as it relates to healthcare, organized the hospitals, etc. Okay, and she was known, Florence Nightingale, which you'll be tested on maybe once or twice, as the first epidemiologist. Okay, because of her, we no longer took care of patients like on the dirt. Patients would be like literally lying on the dirt. She was the one that says, no, put these people on the bed on a clean linen. Let's wash our hands. Let's open up the window so fresh air can come in. And this helped improve the health and well-being of the sick, okay? Nursing continued to broaden in a variety of areas. Earlier you told me how you want to become a nurse practitioner, CRNA, Psych NP, hospice nurse. There's so much you can do with the nursing profession. You can be an entrepreneur and making bucks there too. All right, establish your own business. So the limit, nursing, there is no limit to what you can do with nursing. Okay, now. When it came, these are some of the contributions of Florence Nightingale. Like I said, she identified personal needs, recognized some components as it relates to nursing. The two main components, this is what you need to know as it relates to nursing. What we deal with is health and illness, for sure. This is what we deal with, how healthy you are and how sick you are. And we try to make you as healthy as possible, all right? Now, some more contributions as it relates to Florence Nightingale. I'm not going to stress that too much, but I do want you to be familiar with the IOM. Very important. Institute of Medicine. Anybody have any idea of who is IOM or what is IOM? Ever heard of IOM, Institute of Medicine? No idea, Alejandro? No?
CDC kind of, is that?
Okay, they're apart from CDC. No? Institute of Medicine basically is that organization that tells us how the healthcare profession is performing, whether it be for physicians, nurses, etc. And they're the one that tells us how we're doing, okay? I don't remember how frequently, but they say, okay, there's because of poor communication between healthcare providers, the well-being of these individuals has gone down significantly. They say why we are doing how we're doing, okay, based on their own research. That's basically in a nutshell what the IOM is, okay? It's good for you to know ICN, okay, ANA and stuff like that. I'm not gonna test on you, okay? And the Latin word of nursing, but I'm not gonna test you on that. However, you should be very familiar with the 4 blended competencies related to nursing, okay? Please make sure you open up your book, all right? Because I need you to look at this. When it comes to the cognitive element of nursing, what does that mean, Lisa? Cognitive?
Thinking critically.
Oh, I like that last word that you said. Thinking, not just thinking, but thinking how?
Critical.
Okay, Lisa, since you opened that can of worm, what does it mean to think critically to you?
Well, usually in a hospital setting, you just don't jump to the first conclusion on something. You gather all the evidence and you take notes. And usually ask other notes.
Can you just wait? Can you rewind just a little bit? Just a little bit. You gather what? She's like, I don't know what I said. I said something, but I don't know what I said. What did she say? You gather what?
Evidence.
You gather all the information, all the evidence, all the data. And I like what you said, Lisa. You don't come into a situation and just jump to conclusion. I'm going to tell you what you just explained in a little bit and why I'm so happy you said what you said. That is a part of critical thinking. Jacqueline, critical thinking to you. What is that?
Yep, using all of the tools that I have appropriately. And yeah, not jumping to conclusions because every situation is going to be different. So
Individualized care plan. Oh, yes. Chanel, what is critical thinking?
I was going to say the same thing.
Now, they saw your answers?
Yes, no.
but no, making sure that you're not just doing the first thing that you know. You're making sure that everything is based per patient and that you're doing what is best for that patient.
Okay, you see, nurses who use critical thinking develop a nursing care plan. And this is just a question, but you're using cognitive, right? Approach. All right, very good. Now, technical. Mason, I knew that. I need to know if you knew your name.
I remember it.
What is technical, Mason?
Like skills and like using tools and other resources to help with your care.
So being able to do what you're supposed to do. Like, yeah, I see the Foley catheter. I'm supposed to insert it, but I need to know the appropriate steps to make sure I insert the Foley catheter correctly so I don't kill nobody. Because if you do it wrong, you can cause an infection, lead to sepsis, etc., right? So you need to know what to do and how to do what you're supposed to do. Now, when it comes to interpersonal skills or competency, Janaya, you said Janaya, right? Yeah. What is interpersonal? It's like all the people to call on. You could have called on Joanna, Kiani, Shayla, but you wouldn't call on me. Why? I'm going to find out where you parking at, Professor. Come on, Janaya. Interpersonal. Come on.
Maybe it has something to do with like yourself as a nurse. I don't know.
Partly. It does have something to do with yourself as a nurse. But it's more than that. I need more than that. Hurry up before Anton steal your shine. Hurry up!
I can't think of anything.
Anton is literally trying to steal your shine right now. She's like, let him. Go ahead, Anton. Help us sister out.
Being able to be there for that person and relate to them on a level to where they're
Your relationship. Being there. How you relate. How you communicate with your individuals. Not just the client, but also your peers, your colleagues. Okay? Like, I can't be working with Jacqueline and you know, like, I want her to go to room 6 and not say anything to her. Be like, she's supposed to read my mind. That's not quality interpersonal skill. You understand what I mean? Okay? So interpersonal is how you relate with others. Now, and then you have the ethical and legal. Shayla.
I would say the patient's rights, respecting their beliefs.
I like that. What else? You did the ethical portion. What about the legal? Well, sort of the legal. What about legal?
Following guidelines, making sure you're safe.
Okay. I need y'all to understand. You notice it says blended competency. All of these 4 things blend and mesh together. Okay? Yeah, I should know how to accurately insert a Foley catheter. But if I don't respect the patient's right to refuse a Foley catheter, I have done what? Breached their or broken ethical principle of autonomy, for example, which we'll talk about. You understand? If I didn't communicate that to the physician that, hey, the patient is not urinating enough, their bladder is distended, they are in pain, they haven't, their urinary output is very low since yesterday, and if I don't communicate, there goes the personal to that physician, and if I don't communicate in a timely manner, guess what happens to that patient? Their well-being is going to be jeopardized. Does that make sense? So all of the, and then of course, like I said, if I do get the order to insert the Foley catheter, I communicated, but I don't know how to properly insert that Foley catheter, the technical aspect, that is jeopardized. Do you see how those competencies are blended well within each other? Okay? That's the same thing you're going to see with multiple concepts, nursing concepts. QSIN is basically, again, competency deals with how we, especially as nursing students, deal with patient care, deal with patients or healthcare in general. So the nursing care that we provide is patient-centered. You must understand, patient-centered care is not solely just the person who's lying on that bed in front of you. Patient-centered care also involves the patients who are involved in that patient's care, whether it be family, friends, loved ones, etc. Whoever's involved, you also have to include them, or who's a part of their circle. You also must include them into the patient care as well. Okay, you have to maybe assess them as well. QSIN competency also involves teamwork and collaboration. Chanel may be that great fantabulous nurse and know how to do what she's supposed to do. But if she does not effectively communicate to the CNA, like, listen, I need you to go do the vital signs in room 6. Please make sure the bed in room 10 is, cleaned, etc. If she don't do teamwork, okay, communicate well, if she don't collaborate well, if she's disrespectful, which Chanel doesn't look like a disrespectful person, by the way, okay? Not saying that. Okay, teamwork and collaborative care can be jeopardized. There's no I in teams, seriously, okay? When you communicate well, you work well with especially your assistants, okay? The unlicensed assisted personnel, like they like to call it officially, or your CNAs as we know them to be. Let me tell y'all want to be that nurse who works well with their assistant, okay? Because they will help you out a lot. Trust me, I know, all right? Also, when you have, for example, teamwork and collaboration also involves with how you deal with the different disciplines. Respiratory therapy, PT, OT, speech pathologist. You need to know, if the patient has difficulty swallowing, who are you going to call? Maybe I should do a swallow eval and then consult or recommend having a speech pathologist on board. Okay, that's all part of teamwork and collaboration. Then you have quality improvement. You talked about that quality care. Quality improvement or quality care is concerned with how you provide the care to these clients. One of the things, especially as it relates to quality improvement, and you're going to see this especially when you become that nurse, not that nurse, that great, fantabulous nurse on the unit, they're going to talk about, for example, the falls, the number of falls. How many falls do we have? The goal is to have 0 falls, infection rate, what else? Seizures and all that stuff. So safety, all of that is part of quality improvement, okay? Safety, of course, making sure, for example, the simplest thing is putting the bed in the lowest locked position. Again, safety, making sure if the patient is confused, we make sure we do our best to reorient the patient, keep them in a safe, keeping them as safe as possible. All right. Cues and competency is also about evidence-based practice. Listen, you don't just do things in terms of quality care because grandma said this works or your intuition says this works. Although sometimes you will have to use your intuition. All right. But when it comes to evidence-based practice, or when it comes to quality care, you want to employ evidence-based practice. What does the research says work? In other words, based for example, on this population, we make sure it's best to provide care this way. For example, let's say PICC line insertion. All right. Based on evidence, you should make sure you check and confirm placement before you use it. Because evidence show if you don't check and confirm placement, you might jeopardize the well-being of that client. Does that make sense? That's all part of evidence-based practice, okay? And it differs in terms of evidence-based practice. It differs from unit to unit. It differs from facility and from setting as well, okay? And then informatics. It's all about tech. If you ain't tech savvy, I'm sorry for you. You figure out your life now. If you are not tech savvy, if you have a computer deficiency, laptop deficiency, look at Sakina, what's going on? You good? Okay. All right. You're going to be in trouble because a lot of the things that we do in terms of providing healthcare involves technology and informatics. And also, with regards to informatics, informatics also involves ethical or legal principles in terms of making sure you protect the patient's information, HIPAA, which we'll talk about that. Also making sure in terms of protecting patient information, like you don't just give out your password to anybody just because you want to. You're making sure you protect the patient's information by the via the screen, etc. Okay, the screen, the block, you know that type of screen that, yeah, the screen protector. There you go. Okay, those kind of things. As it relates to nursing, we always aim, or we should aim, to promote health. If you have no issues, that is our goal. That is what we like. We want to make sure we keep it that way. Keep you healthy, okay? We also prevent illness. In terms of illness prevention, there's three main preventative levels. Do we know the preventative levels? No? Never heard of it? Oh! I forgot my stickers. Cornelius, tell me about primary. Write that down because you're going to see it. Now I can test y'all on it. I don't know if it's in this chapter, but now Cornelius like, I don't know it. Let's go. What's primary? What can you tell me about primary real quick?
Primary is like just regular doctor's visits, health. Preventative care, basically. So making sure you're going to your yearly physical or checkups.
So really primary is education, and somebody said it, immunization. Okay, you do get that when you go to your doctor's visits and stuff like that. Okay, secondary.
Testing, screening.
Screening. Okay, you start having some signs and symptoms of something. Now we gotta figure out what's wrong with you. Why you coughing? Why you in my office? Why are you guarding your stomach? Okay, let's do diagnostics to find out what's going on. Let's do some labs. Let's do a chest x-ray, etc., etc. So that's the screening. Okay? And then tertiary is basically what? Treating, okay? We try to keep you from going 6 feet under. We're trying our best to keep you from going 6 feet under. This is where you see like rehab, etc. Okay? Now, I want you to understand, and I'll say this again, any level, education is done at every single level. Let me say this again. Education is done at all levels of prevention. It's just the type of education that you're providing that differs in each of those levels. Primary level, okay, you ain't got no broken bones, you ain't sick, eat healthy, low salt diet, well, not low salt diet, healthy diet, eat your fruits and vegetables, make sure you wear your helmet, don't be ghetto, and wear your seatbelt, those kind of things. That's the type of education you'll mostly see in the primary level. Secondary level, again, in addition to screening, your education is like, okay, let's find out why you're coughing profusely. We're gonna do this type of diagnostic testing. These are education. You're explaining the diagnostics, why we're doing this diagnostics. Now, you may not explain, because it's not in your role, you may not explain the results, because that's the role of the physician, but you're explaining what you're doing. Does that make sense? That's a sample of education that you'll see in the secondary level. And then treatment, of course, in the tertiary. All right, this is your medication. This is why you're taking this medication, etc. That's an example of the type of education you'll see at the tertiary level. But education, you must know, is at all three levels. Other aims as it relates to nursing practice is restoring health. Okay, so you are sick. We're trying to, again, get you better. All right. You were coughing. Let's see if we get you these. Let's do this treatment to keep you from coughing. Let's also encourage you to increase your fluid intake, etc. So we try to restore your health. And then, of course, we also aim to facilitate coping with disability or death. Like we said earlier, you will be dealing with death. The goal is we're trying to have the clients die with dignity. Respect their wishes when they're dying, educate the family on what's going on, or the loved ones, whoever's involved in the patient's care when it comes to death. Disability, again, how we educate you or help you cope with this new disability, okay? Like now you have to walk with crutches, maybe for a significant time period, or you have to be in a wheelchair. We're going to educate you on how to transfer from like bed to chair, etc., safely. So that's how we help you cope. And coping also involves letting the client express themselves. Let me say this again. Coping also entails, I know it's not written like this word for word in this section, but it also entails allowing the client to express themselves. And that is in any way. If they want to curse you out, they may call you out your name. You will respectfully say, please, sir, ma'am, slow your, well, don't say slow your roll, but you know what I mean, okay? But you got to understand, sometimes they are not mad at you. They're mad at the situation they found themselves in. And that's how some people cope or deal with the situation, okay? Allow them to cry, allow them to get mad, allow them to shout, etc. Sometimes it actually helps them feel better. So that's part of coping with either the disability or death, okay? Allowing expressions, okay? I already just said all of this. Now, you should know the factors that affect health. Genetic inheritance. Shayla, genetic inheritance. Explain that to me.
Something that runs in your family.
Something that runs in your family. Give me an example. Diabetes. Okay? So if you know diabetes runs in your family, or you find out mom and dad has diabetes, what would you tell to that client whose mom and dad also have diabetes? What would you do?
I would educate, be careful with, I would probably suggest maybe screening, be careful with what they eat.
Okay, what else?
Be active.
Be physically active, okay, those kind of things. So again, because they have this genetic inheritance. What about cognitive abilities, Cornelius? How does cognitive abilities affect health? Is that the right time? 11 something?
It's 11:10.
Okay, yeah. Just making sure because I want to see how much time I got. Cognitive abilities.
I guess how well you're able to understand your diagnosis.
Ooh, okay. Explain that. Elaborate just a little more.
I mean, I'm trying to think of, like, if I take a family member that might not know anything about diabetes and you tell them, like, hey, you're now a diabetic, right?
Mm-hmm.
People might not understand what that means. People don't really understand what it means to be a diabetic, I guess I could get, like if I take a personal example, I have a certain disorder with my knee, and like not even my doctor knew what was going on with it. We had to go see specialists to like figure out what they actually found when I had like an arthroscopy done. And so I'm like, I think from a cognitive abilities, maybe like I didn't actually understand what was going on, and I didn't know how to prevent it from returning, you know,
Okay.
in the future. And so that's to me what I would consider cognitive abilities.
So if you say that's cognitive, then what is education then?
I think that.
I'm asking what's education
Well,
then?
yeah, I guess cognitive ability might be the ability to understand the information. Like maybe you're trying to explain something in depth to a 3-year-old and they might not actually understand.
Okay, all right. Kenosha?
Yes.
Okay, I'm gonna get it. Kenosha? Okay, I'm gonna get it. I promise. By week 16, I'm gonna get it. She's like, huh? Tell me. Explain.
Is it more like mental illness that can affect like some mental illnesses like depression can cause autoimmune diseases to affect your health?
Ooh, you treaded on thin ice right there with that one. Wait, Macheska, sorry, I'm so sorry. Macheska, I see the S is right there.
I was just wondering if cognitive abilities is like someone not having like the mental capacity to understand really what they're going through.
Elaborate mental. What you mean mental capacity? Because that's the same thing like Kenosha was saying.
Like not having a good understanding of what they're going through, whether that is because they have, like for example, multiple sclerosis. They have this other underlying issue that they might not be able to, get to the healthiest foods or be able to walk as easily to better their health.
Okay, let me see what Trinity working with. Hold on, let me see. Trinity?
Kind of bouncing off what you said, like an example, trying to explain to like a dementia patient that they have dementia.
Okay, there you go. There you go. There you go. Right there. Because, first of all, I ain't never heard of dementia in my life. What is dementia? How you going to say the word and not know what you going to say?
Alzheimer's, like you forget stuff.
Okay, you're forgetful. So will you have the cognitive ability to understand what I'm saying? No. You see, because you guys mentioned diseases like knee issues, mental illness. Just because I have a mental illness like depression or okay, let's just say stick with depression. That don't mean I don't have the ability to understand what you're saying to me.
That's not necessarily true. I mean, specifically with like bipolar disorder, I have
Well,
like my
yes,
cousin has
schizophrenia,
bipolar
something
disorder,
like that.
and when he's manic, he doesn't understand. What
Okay,
you're
that's why I
saying.
said certain.
He goes off of his meds. Same thing with my sister has manic depression,
Mhm.
so it's chronic.
You hear what you said?
So it's but
Well, hold on,
like
hold on.
regular depression, maybe no.
Okay, you hear what you said? There you go. You see, you giving different
Postpartum
specific.
depression also can alter the way that you think, what you understand, what you perceive to be normal.
Okay.
Like, so
Let me, cause I like it. Let me tell you why. You see that you said manic, postpartum depression, schizophrenia. Yes, you're talking about severity of illnesses where at that point in time, ain't no point in me explaining you, okay, this is your diabetes medication. Okay, you're taking it to lower your sugar. And you're at this manic phase. Okay? Because yes, cognitively you understand? But when you say something simple as depression,
I was trying to get
you okay? I gotta make sure because I can put that on the test. I'm gonna put that on the test and watch what y'all. I'm gonna knock on wood for this against it. Watch what other students. I'm gonna say watch what other students. I'm gonna say other students gonna do. I put something that's simple as simple depression. You know how you gonna answer according to manic schizophrenia.
well, but that's the thing.
You see, but y'all be adding stuff. Y'all be adding stuff.
But that's the thing.
But what?
Depression is a big, like it's
It
a
is
spectrum.
it is
you know
a big
what I'm saying?
spectrum.
So if you're just saying you're just putting depression
depression on the table, what are you talking about?
Okay, no, that's why if it doesn't specify the severity, you can't answer according to that. You shouldn't answer to that.
So specifically,
It has
what you're
yes.
And is that when?
Because that's why the example, that's critical. That's why the example that Trinity gave was perfect in terms of cognitive ability. You understand? For also another great example is those who suffer from developmental delay. Just because I'm 45, but doesn't mean I understand if I have a developmental delay and a level of thinking of a 2-year-old.
Yeah.
This is where Lisa's statement earlier, don't just jump to conclusion. Your assessment, gathering data is very important because there's a developmental delay. You understand what I mean?
Yeah.
That's cognitive.
Well, isn't that why they always tell you, isn't that why they tell you to try to explain things in layman's terms? Like explain it like you're explaining it to a child who doesn't understand?
Depending on the person. Not regardless. Not always regardless.
Not obviously.
No.
You're not
Yes. Because some people will get offended.
But you have to make sure that they're able
to understand.
Like, what if the person has Down syndrome and they just don't know?
There you go.
So it's more like that.
Yes. Okay.
No, layman's terms meaning you're explaining it to their level of understanding.
Their level of understanding. Yeah. Exactly. Now, this is where you guys kind of mesh together the educational level, which is what I want to rectify. Education level is now, I'm 45. I have a PhD. So you're going to speak to me at that level of understanding. But just because I'm 45 doesn't mean I understand. Well, I may have the understanding at the level of a second grader. So you're going to have to speak to me at that level.
It could also be, like, let's say my mom doesn't speak English, and if somebody's speaking to her...
That's language barrier. Okay. That's language. Don't come... See how you're doing? Don't mesh the two. Because y'all like to mesh a lot of things together. And then when the question comes, now I have to be like, that's not what the question said. Okay? And I'm trying to avoid this. Right now, I don't know if it's gonna work. TikTok, we gonna see. Okay, you understand? Education level means your level of understanding based on your level of education. I have a PhD. Now, let's say, for example, I like the example you gave with the knee issue. Just because I have a PhD doesn't mean I know what arthroscopy means. You just have to speak to me at an educated level and explain it. You're not going to speak to me like, listen, I have my PhD and you come to me talking to me like, listen, so what happened was, you see, this is your knee, and then we have to put this thing in your, how am I going to feel? Like you're insulting me. You understand? So that's level of education. Does that make sense? Which is kind of different from cognitive in my ability to understand based on certain disease processes like dementia, severe, manic, depression. You understand what I mean? Those kind of things. Does that make sense? This is why, again, you always assess prior to intervening. You always collect data prior to intervening. Yes, Sakina? Sakina or Sakina? Okay.
So the cognitive ability, that would be if somebody is not having good cognition, they will have somebody in place so they can be the person, the primary holder.
Hold on. What you mean? Okay, let me.
Person that's helping them because they will be their caregivers.
Let's be careful because when you say they will have somebody in place, it's not always the case. Okay. They not everybody for several reasons. Maybe they're from the state of the ward kind of thing. They're not always going to have that advocate. You still have to be able to explain to them at that level of understanding. But if they do have somebody in place, which is what we would like, yes, and they're legally the ones making the decisions for them, yes, you would explain it to them. All right, we cool. Kiani, I already feel she's gonna give me problems. I feel like she's already. Ooh, wait! I feel like she's gonna come. Like she's ready to argue. Like, you know.
I just want to be clear because I will be the person that.
I know you will be. I will be. Listen.
But what?
Yeah, I will.
So I know that's why I'm clarifying for my own.
Oh yeah.
Sanity.
When I get
it wrong, I can look back and be like, nope, she didn't say it.
That's why it's recorded. Did you see? So they don't come from me. I'm be like, see, this is what I said. And if I make a mistake, I'll correct my mistakes, okay? But we do understand the difference between those two, right? Mason? Yeah. We cool? Mason look like he about to give me problems too, like. No. All right. The other factors we can kind of understand in the interest of time, race and the ethnicity, developmental level, socio, those you can understand. Like developmental, because of your age, like you're not going to explain to a 10-year-old the same thing in a way of a 40-year-old. Exactly. All right. While in developmental, just know for this term, even though they talk about the pediatric population, it worked last semester. Thank your predecessors. I will not test you on the pediatric population. You might see peds here and there, but it's not specific to them. It's gonna be something general. Okay. All right. Moving real quick. Healthy People 2020, y'all should know about them. They just change every 10 years about global health and goals and stuff like that. I ain't gonna test you on that. Now, I already talked about preventing illness. You just need to know also with regards to education, how the person prefers to learn, okay? Are you gonna teach, some people, they like to read, they just like for you to explain it to them, so they're listeners, auditory listeners. You just wanna make sure you assess their learning preferences and educate them according to that, okay? And we already talked about restoring health, etc. Now, your roles, y'all say y'all wanna be nurse this, nurse that. I wonder, I hope y'all know, y'all gonna be wearing lots of hats at one time. You're going to be caregiver, communicator, teacher, educator. It doesn't say this. You're going to also be what do you call the people that do the shampooing? Therapist. You're going to be therapist. You're going to be a masseuse. You're going to be they're like, who got time to be a masseuse? A hairstylist sometimes. You're going to be a nail tech. You're going to be all up in their toes, and stuff like that. I hope y'all ready. Okay, spa maybe.
Well, not like that, but you gotta try and make it so they don't feel like you're intruding.
Yeah, okay.
Yeah, make it not weird.
Oh, you gonna be a cook too, by the way. I hope y'all know y'all gonna be cooks,
Yeah, and a butler.
And a butler, okay?
And a maid.
True, because you're gonna be cleaning them rooms. You better be cleaning rooms as time permits. Now, guys, let me tell y'all something. For real. I have to educate you as entry-level nurses. The role or the priority of the roles that you actually have to take on will change depending on the unit that you work in. Like, you can't be in the ER and be like, there's like patients dying, blood gushing, and be like, oh, let me clean this bed right now, Because Dr. Semi said, I better fix my pillows. And then you got blood You're going to prioritize your care according to the unit that you work in, the facility that you're working in, and the issue that you're dealing with, okay? You mentioned also advocate. No matter what role you're in, no matter what unit you are working on or facility, you are always a patient advocate. You are always advocating on behalf of the patient. And advocate doesn't necessarily mean you're just a lawyer and standing on trial for them. No. But advocating meaning, for example, let's say the patient has sickle cell and they don't have all they got for pain is Tylenol 650. And you see your patient is in pain and the doctor, for whatever reason, didn't order Tylenol, didn't order something stronger. You'll be advocating on behalf of the client when you call that physician and say, listen, we need something stronger than Tylenol 650, okay? Can we also, in addition to fluids, get him something stronger like Percocet or maybe Dilaudid or something like that, okay? Depending on the need. So you're advocating on behalf of the client, all right? And of course, you're a researcher and collaborator. Moving on because I got chapter 4 to do. Now, we already know nursing is a professional discipline. I already talked about this in a little bit, but the reason why nursing has become a professional discipline in addition to evidence-based practice is also because we also operate on a code. Okay? Our quality, our priority is patient care. All right? We make sure what we do and how we do what we do it based, first of all, with the patient at well-being at the core, okay? And we do it with pride. Like, just because you know how to start an IV doesn't mean you have to leave it, like any old kind of way. You understand what I mean? Just because, if you have 2 minutes, go ahead and comb the patient's hair. Just because, it's the CNA's job to empty the urinal, and you right there, doesn't mean you can't empty the urinal. Like, you better not be. I will be the fly on the wall. Okay? You better not be that nurse who gonna spend 20 minutes looking for the CNA to do something you could have done in 2 seconds. I will come for you.
I know.
I will.
I was that CNA that they would come
Me
look
too.
for, and I'd be like,
bruh, you was right there. Like, you was right there.
I'm on lunch and they're just waiting at me at the door for me.
Yeah.
Can I?
So you.
So.
She gonna come for me on an example. You see how we bonding in?
One mind.
Okay. Alright. And then of course we're an established discipline because, like we said, we do research ongoing. We have PhD level and DNP level nurses as well. So that's what makes us, all that in a bag of chips and then some. All right. Now, educational prep, you must know that there is various levels of education. I will test you like maybe on the quizzes, okay? The levels of education, because you should know it. You have your LPN, and the reason I want you to know this is because you need to know the scope of practice of every individual who works underneath you and above you. It's very important for you to know this, okay? Because it's important so you know how to communicate and delegate and collaborate effectively. So, for example, you have the LPN. I know, well, it's not listed here, but underneath the LPN first, in terms of the lowest of the, I shouldn't say lowest. I don't like to call my CNAs low. They're not low, okay? But you have your unlicensed assistant personnels. Okay, you got to be familiar with that term, or your CNAs, okay? They are the ones that do the very basic task, bed making, feeding, vital signs. The only assessment that they do in terms of data collection is vital signs. It may be AccuCheck depending on the unit. AccuCheck meaning glucose monitoring. It depends on the unit and the facility. Not every facility allows them to do AccuCheck. But for sure, in terms of data collection, they will do vital signs, okay? They empty urinals. So the very basic task is done by the assistive personnel, okay, the CNA. Above the CNA, then you have the LPN, licensed practitioner, practicing nurse, or LVN, licensed vocational. I don't know what's the difference between practicing or vocational, but same enchilada, okay? LPN, LVN. They do everything that the CNA can do, but in addition to that, they also pass meds. They can do some very little assessments. They take care of the stable clients that have a predictable outcome. So we mentioned diabetes earlier, for example. We know if that diabetic patient go ahead and eat that donut like they're not supposed to, we know that their sugar is gonna go up. Give them a little insulin, boom, boom, boom. Patient is back to being Gucci, right? Now, so we can give the LPN those clients. But if we have a patient whose status post like this open heart surgery or whatnot, we're not giving that to the LPN because that patient is kind of critical. Not kind of, it's very critical, okay? So we don't give the unstable clients to the LPN, all right? They can also do other tasks like maybe insert Foley catheters as well. Depending on the facility, they may be able to insert NG tube. Not all facilities allow them to insert nasogastric tubes, okay? They can also take care of the ostomy, etc. Okay, so those are some of the things that the LPN can do. But in terms of assessment, that is really left up to the registered nurse, who is next in terms of hierarchy. Okay, so you have registered nurses. Whether you have a BSN or ASN, let me tell you what the RNs do. We the one that's gonna be eating up in here. Okay, yes, we eat, which is what y'all gonna be doing soon. But when I say eat, and make sure you remember this. Can y'all see? Oh, I should have remembered this. Okay, eval, assess, teach. Remember this, okay? You evaluate, you assess, and you teach. The RNs are the ones that's doing that. What do RNs do? Okay, we eat. I need you to remember that from this day moving forward. This is not something you remember only for today or for this semester. This is until you decide to no longer become a nurse. To be a nurse. Even when you decide not to be a nurse, I still want you to know it. Okay? Y'all gonna be nurses forever anyway. Okay, I said it. I called it into existence. All right? Eat. You need to know this. You need to know your role. Now, and we'll talk more about this later on. Now, you do need to know that there are several levels of registered nurses. You have the diploma nurses, the associate degree nurses, and the BSN nurses. The main difference between the BSN and, I don't know with diploma nursing, to be honest, okay, but it's whatever, it's very basic. But the main difference between associate and baccalaureate is, as BSN nurses, we're preparing you to be actually leaders. So don't be surprised within 3 months of graduation and starting, they're gonna make you be charge nurse. They won't do that. It's not likely to have that done with the associate, because associate level nurses, we don't teach leadership.
I don't think you also can. I've never.
Well, no.
It's impossible.
No, actually it's not. It depends on the need.
That's what I'm saying. I'm not saying it's impossible, but it's not.
Heard of, yes. Okay? But it's not unheard of, because desperate times, let's just say, calls for desperate measures. Okay? Now we need somebody. Okay? But if there's a BSN like y'all on the unit, Cassandra, you just graduated, passed NCLEX on the first attempt like you are supposed to, and then all of a sudden, you're working as the nurse. You only been there 2 months. Cassandra, I need you to be the charge nurse. Cassandra, like, oh, adios mío. Okay? And then all of a sudden, Spanish galore. You know, like, hey, me, I just started, okay? All right, Cassandra, you got a bachelor. You prepare for this, okay? So, Cassandra, you're Hispanic, right? Are you Hispanic? I thought Cassandra was Hispanic. Look, stereotype. Cassandra just going with the flow, too. She speaking Spanish? Okay, I get it. All right?
Very similar.
I know, but I just looked at her face. I'm like, she looks Spanish, you know. Joanna, are you Spanish? Yeah, okay. I don't know. Let me stop. Okay, so that's the BSA. That's the main difference, is leadership. Okay? Graduate education, of course, you guys, like you said, you're going for your graduate degrees, get your master's. You're going to get your CRNAs, nurse researcher in the house. Try to make sure you recruit them too, okay? Don't let them stay behind. Y'all got to get your PhDs. I don't care. Figure it out, okay? Increase that 1% or 2%. I don't know. We're low. And then, of course, there's continuing education. Every state requires that you renew your license, you have to do your CEUs, continuing education. That's everybody. Just know. It's different at each state. Some states require 24. Most states require 24 credits. Other states, I think, goes as high up to 26 or 28 credits. So it depends on the state. That's continuing education. And then in-service. In-service is basically depending on the facility where you at. You just got to be educated on how to use the pump, how to use the new system, etc. So that's in-service education. Okay? In terms of level of education. Yes, you will be tested on this. Now, you should know your guidelines for nursing practice. Not you should know. You do need to actually know, because it is your responsibility to know what it is you are even allowed to do as registered nurses in the state in which you are practicing. Each state has different guidelines. It is very important. So we all, regardless of the state where you practice, we all have standards of nursing practice. Like Jacqueline can't go out in the street and start a trach. Okay, you can't do that. You could give trach care, but you can't start and cut people, because you saw it on Grey's Anatomy. Okay, you can't do that. Okay, you have the Nurse Practicing Acts and licensure, and then of course, what I will drill into your head forevermore, and when you come back to me 3rd and 4th semester, the nursing process. What is the nursing process? Who did I not? Alexandria, you Hispanic?
Assess, and teach.
Nope, that's not the nursing process.
It's the way that I was making the face like I don't know and you still ask me.
Do you know the nursing process?
The nursing, no.
Nobody has any idea what is the nursing process?
Is it how a nurse is supposed to go about treating a patient?
I'll take it. Lisa?
Is it related to SBAR?
No. SBAR is for communication. Anton? Anton's like, don't even look at me. I got zilch. Y'all do know the answer is in your book, right? Y'all do.
Guidelines for nursing?
It is the guideline for nursing. Yeah. Anton, what's the answer?
Allows nurses to use critical thinking and clinical reasoning.
TikTok. ChatGPT? No. Trinity.
Scientific method for nurses.
Say it again.
Scientific method for nurses.
Trinity, can I show you to the TikTok world so that they know that you actually answered the question correctly, even though it took 10,000 years to get the answer? But see, TikTok, 10,000 years later, she finally what's it so TikTok can learn?
The scientific method for nurses.
The scientific methods for nurses. Who also gave me an answer? What was the answer you gave me earlier?
I said just the way nurses, it's a guideline on how nurses should go about treating their patients.
It's a guideline. Okay? Now, what are the steps, Anton? Did you chat GPT that? No? Hi, TikTok. Say hello. Sakina, tell TikTok what the answer is.
Assessing, diagnosing, and planning.
You
and
missed
implementing and evaluating.
Okay, say it one more time. What are the steps of the nursing process?
Assessing, diagnosing, planning, implementing, and evaluating.
Y'all hear that? That's the step. You must know this. People, do not play with me on the nursing process. Add pie. That's the famous answer. Assess, diagnose, plan, implement, or intervene, eval. You must know this. You must know the nursing process. I don't care. I know TikTok gonna be out here when I post this, gonna be like, it's not important, nursing process sucks. You do this all the time. And when you think about it, even y'all been doing the nursing process, especially if you got kids, y'all been doing the nursing process. Okay? You actually collect data. Based on the data you collected, you figured out, oh, this child is very hungry, and if I don't give this child something to eat, this child going to drive me insane in the membrane. So my plan is to cook well, not even cook because I ain't got time to cook. Maybe it's going to be easier for me to just make a turkey sandwich. That's my plan. I actually made the turkey sandwich. Now that I intervened, I gave the turkey sandwich to this child. Now let me see, my interventions actually work. My interventions did not work, which is my evaluation, because this child is still crying. They want Mickey D's. They ain't going to get Mickey D's, but we're going to try something else. Let me see. You understand? That's the nursing process. The nursing process. Nursing process. You see that? Okay. You see how I explain the nursing process real easy? We're going to go in depth one of these weeks in the nursing process, but I need y'all to know this. Now, I don't want you to just know add pie. Let me be serious now, because this is going to help you a lot in how you answer the questions. I don't want you to just remember add pie. I want you to tell me what it means to assess, diagnose, plan, implement, and eval. That is your homework, and we will discuss that more in depth, because it's going to help you when you answer these questions. And I will explain that later on in the term, okay? But for now, we're going to keep it moving. That's the nursing process. We talked about it. the trends is good for you to know, but I honestly am not going to test you on those trends, okay? This is basically, and you'll see the trends talked about throughout the nursing programs, what to look out for in terms of global health, the changes that are taking place in global health, okay? Now, I do want you to know that, yes, there are early signs of fatigue in nursing profession because you will be dealing with this as nurses, and you want to know how you could prevent it at all costs, like compassion fatigue. If you are a compassionate person, which I better be, and I can't teach compassion. I can only talk about it. Compassion, I feel, is something that is innate. But when you care so much, it can become cumbersome to that healthcare provider, okay? Especially whether it's in general or because you're dealing with a particular client, you get so involved. Sometimes you'll find yourself very invested in certain clients, and then when it doesn't come out, things do not always work out the way you intended, despite your efforts. It can have an impact on you as a nurse and your well-being. Burnout. We just talked about it. You are overworked, you will be overworked. Then also signs of fatigue is secondary traumatic stress as well, okay? That's chapter 1.